You know, the heat, those hot temperatures can take a toll on your mental health. A 2022 study found mental health-related ER visits increase during days of extreme heat.
Yeah, Fox Carolina's Carrie Veal spoke with a family doctor in North Carolina about how to keep your cool mentally and physically.
Yeah, that study was published in the Journal of the American Medical Association. It found there were a few mental health conditions that we saw more ER visits. So those are substance use disorders, schizophrenia, anxiety or stress-related conditions, and childhood onset behavioral disorders. I spoke to Dr. Lee Joseph, who's a primary care physician for Teladoc Health in North Carolina. She says there are various factors that can cause a mental health breakdown.
I believe that could be because of just the stress, the irritation of being in hot weather. That can be stressful for some people, and also the disruption in sleep patterns and disruption in routines. So we see that spike in cases of anxiety and depression.
Now, there's a few ways you can prevent these heat-related illnesses. Those include stay hydrated, get a good night's sleep, and restrict the amount of time that you spend outside. So if you can, go outside in the morning or the evenings, not the middle of the day when it's the hottest out there.
That's right. Good tips, you know, you can wake up a bit earlier, enjoy the outside a little bit more before the sun really gets up and going. There are also some other things that you can do as far as in regard to medications and stuff in protecting yourself mentally and physically.
Yeah, so there's certain people that are more vulnerable to having some of these heat-related illnesses. So the elderly, anyone with heart conditions, anyone who's obese, and if you're on certain medications, there are certain medications that can make you more dehydrated. So you just have to pay attention, particularly if you're outside and you're taking a certain medication. So just talk with your doctor if you're not sure if it's something that could impact that, but just something to be aware of.
Yeah, I mean, just a reason to hydrate more. Always
Yeah.
be drinking your water if you're going outside in those
cannot
warm
hurt.
temps. Yeah.
Read the label, talk to your doctor. All right.
Yep.
Carrie, thanks.